Welcome to today's live event, Healthy Indoor Living in the Time of COVID-19, featuring leading wellness real estate and technology company and Barometer partner Delos. Delos's Darvin homes in Australia integrate Barometer's outdoor air quality data into their dashboards that display indoor environmental conditions, highlighting the importance of understanding both indoor and outdoor air quality in tandem. We wanted to thank you for joining us. We do not take it for granted that you've decided to spend this time with us, and we hope the presentation will be of value to you. Before we get started, we wanted to go over a couple of housekeeping items. Today's session will be recorded and emailed to you afterwards. There will be Q&A session at the end of the webinar, but feel free to send your questions at any time by using the QA panel that can be found when you click on the QA button at the bottom of your Zoom screen. Today's hosts for this special live event are Barometer Chief Scientist, Dr. Gabriela Adler, who has an MSc and PhD in atmospheric science and has worked as a research scientist at NOAA, National Oceanic and Atmospheric Administration, and is an expert in chemical and physical processes related to air pollution. Gabby believes it is her greatest duty as a scientist to bring science to the people. Her role at Barometer is cross-departmental, to say the least, and includes consulting on all algorithmic queries, both internal and external facing, product development and roadmap from the scientific aspect, as well as furthering the environmental research in the name of the company. And today, we have the honor of being joined by Dr. Chuan He, Senior Director at Delos Labs, Delos Living LLC. Chuan is a researcher of indoor air quality, indoor environment monitoring, and building systems. He leads the framework development of algorithms for home automation systems that work to improve indoor environment and the well-being of home residents. Before joining Delos, Chuan focused on evaluating the performance of air cleaning technologies under different conditions with the American Society of Heating, Refrigerating, and Air Conditioning Engineers. Thank you for joining us, Chuan. This presentation is intended to educate, inform, and nothing herein and any resources provided by Barometer or Delos should be considered as or used as a substitute for medical advice, diagnosis, or treatment. So, in order to grasp the importance of the air we breathe in this new normal, I think it would benefit our understanding of what we are dealing with in terms of the indoor solutions to come if we address some of the facts regarding the virus spread, pollution indoors and out, and even the connection between the two. And with that, I will pass it off to our experts. Chuan, take it away.
Exactly, Ronette. As the saying goes, in order to win, we need to know the enemy. To be able to come up with efficient solutions, we first need to understand how COVID-19 is transmitted from one person to another. Based on what we currently know, the virus can spread from person to person through small droplets from nose or mouth when the infected individual coughs, sneezes, exhales, or just talks. People can be exposed to COVID-19 if they breathe in those droplets during the close contact with a person with COVID-19. This route is labeled as number 1 in the figure. These droplets can also land on objects and surfaces. So another way that we can get exposed to COVID-19 is by touching objects or surfaces where COVID-19 droplets have landed, and then touching our eyes, nose, or mouth. This is the second route. Despite me calling these droplets small, they are actually quite big aerodynamically, about 5 to 10 micrometer in diameter. They usually don't travel far or stay in the air for long, but before we take a big breath when we are 6 feet away from one another, there is still one more transmission mechanism that is plausible and a bit more complicated. It is called airborne transmission, labeled as number 3 in the figure. The droplets generated by an infected person through talking or exhaling quickly break down within milliseconds and become fine particles that could hang in the air for up to about 3 hours, according to the latest research. It may travel with the airflow in the room, farther than the large droplets emit, and be inhaled by people who are in the room, but not necessarily at the same time that the infected person is present. While direct transmission is thought to be the main way that COVID-19 is spread, we actually don't know yet which of the routes of the transmission is the domain one.
Thank you, Chuan. I think we should pause here for a minute and focus on this third mechanism that you mentioned. This mechanism is less known, I think, to the general public, and the implications of it are that wearing gloves and keeping the 6 feet or 2 meters from each other is just not enough, as the virus is actually present in these small droplets that are suspended for a long time in the room. Let's discuss for a minute what are these small droplets. These small droplets are technically called aerosols, which are defined as solid or liquid particles suspended in the air. In terms of air pollution, we call them, or they are called particulate matter, which are taken as measures of either up to 2.5 microns or up to 10 microns. For a visual reference, you can see in the slide a human hair in comparison with the particulate matter of both size. Imagine if I take the hair and divide it by 1,000, that would be more or less a size of a typical aerosol. And between you and I, Chuan, or rather between me and the screen, because we're far away, we have about, I estimate, 5,000 aerosols floating right now. So the coronavirus is also a type of PM around the size of 0.1 micron. You can see in the slide reference of the size compared to blood cell or other particulate matter. And on that topic, I want to refer the audience to Lindsay Marr, Professor Lindsay Marr, an engineer professor from Virginia Tech, who is an expert in airborne transmission of viruses and has a series of YouTube videos explaining this and other papers that she has written about this subject. What she says in short, as Chuan touched on, is that understanding the size of these respiratory droplets is important to understanding the way that the virus is actually transmitted. And often people think that a person who sneezes or coughs present the most danger, but actually from speaking or even just breathing, small droplets are emitted which can linger in the air for a long amount of time and spread to distances that are further than the 2 meters or 6 feet. And if I want to complicate this even more, there are recent studies that suggest that particulate matter can act as a carrier for the COVID-19, allowing the virus to float in the air longer and to be widespread to larger distances. For example, you can imagine that the virus is on top of a dust particle and that travels for very long distances. But again, we need to keep in mind that these are very preliminary results and require further study. So regarding the images you see on the slide, the image on the right is based on a variety of environmental factors contributed to pollution burden score, derived at the California Office of Environmental Health Hazard Assessment in 2018. This is compared to the COVID numbers released by the city of San Francisco last week. You can see the similarity. But of course, we need to take these similarities with a grain of salt, which is also a type of PM, by the way, because the pollution burden score is derived of several factors, but not only because of that. And it does, but it does further support the case of potential connection between air pollution and COVID spread. So to summarize, we discussed 2 potential under investigation, very dangerous mechanisms for the spread of the virus. One, which is directly related to indoor spread, is the danger of small droplets lingering in the air for a long amount of time. And the other related to a spreading mechanism outdoors, which has the potential to affect our air that we let indoors through open windows, ventilation, etc.
Thank you, Gabby. Thank you for the correlation between the coronavirus and the air pollution. In fact, Americans spend approximately 90% of their time indoors, and this is based on the research before COVID-19 outbreak. So now I'm imagining we spend even more time indoor. This is important, Gabby, because most of the transmission will occur indoors these days, as that is where the people are. We are following the stay-at-home guidance to limit exposure to those we interact with by staying within our individual family unit. But that means longer exposure times to indoor air, which can be contaminated by many types of pollutants, like particles, chemicals, pollen, as well as germs. This presents an opportunity to focus on the overall indoor air quality, including pollutants as well as potential passengers that can lead to infections. For example, longer time spent indoors, especially with whole family members, leads to higher CO2 generation. Certain activities that would normally be done outside the room, such as workout exercising, also generate lots of CO2. People also cook more when they are staying at home. That generates particulate matter, NOx, CO, or VOCs. In addition, increased use of chemicals in our home for surface disinfection increase personal exposure to those chemicals. And finally, the common indoor air pollutant source still exists, such as off-gassing from furniture and floor, infiltration of the outdoor pollutants, mold and fungi that can be easily found in the wall leakage.
Thank you, Chuan. Actually, it makes you think that the exposure or long-term exposure to these pollutants, and linking back to the COVID-19, there is a really interesting study, first of its kind, for a group of scientists at Harvard that found a potential correlation between air pollution exposure and the COVID-19 mortality in quite a dramatic way, as you can see in the slide. And it's not just indoor pollutant that we need to be concerned about, right? We are still going outside. The amount of time that we spend outside will begin to increase, hopefully, as the virus stagnates across countries. And even when we are indoors, we are opening the windows, we ventilate with the air outdoors. And we need to take the outdoor pollutant into consideration as well. So there has been many articles about pollution in the time of the COVID-19 and long-term exposure to air pollution and respiratory diseases. So I wanted to take a moment to explain the differences between the different types of pollutants. As Chuan explained the indoor pollutants, I'll explain a little bit about the outdoor pollutants. So what is pollution? Pollution is basically any substance, can be a gas or particulate matter or particles that are in high concentrations or can be harmful to our health. And we can divide pollution to natural or anthropogenic. Anthropogenic meaning man-made. So examples for natural pollution can be mineral dust, dust storms, or pollen, fungi, bacteria, viruses. And examples for anthropogenic emissions can be, for example, NOx that comes from traffic, or CO that comes from or industry, and soot. But there are pollutants that can come from both natural and anthropogenic, like particulate matter. It can be dust that is natural, but it can be soot that is coming from vehicles, for example, or VOC. VOC is volatile organic compounds that can be very harmful and come from anthropogenic sources like benzene, and it can be a gas that smells like lemon. For example, a limonene is VOC that comes from a lemon tree. But there is another pollutant that is not always thought as a pollutant, and that has a harmful effect on our health, and that is pollen. And as the coronavirus broke out exactly in the peak of the pollen season in many locations, you can see the impact it has on the health system. as well as the impact it may have on the severity of sensitive population. And this is also must be taken into account when making decisions about the indoor or outdoor air we breathe.
Thanks, Gabby. Knowing there are many types of air pollution around us, there are 3 approaches to improve our indoor air quality, including source control, ventilation, and air cleaning technologies. Source control is about identifying the pollution source and removing it from the indoor environment. It is usually the most effective method, but it is also the most difficult one to apply in real world, especially when the pollutants are coming from outside, like traffic emission, pollen from grass and trees, and combustion pollution, as Gabby described earlier. Let's take a look at the other 2 approaches. Ventilation basically means replacing indoor air with outdoor air through a mechanical fan system or through the windows or other openings of the building. No buildings is perfect yet. The third one, air cleaning technology, removes targeted pollutants from the indoor air by using filtration or purification devices. Now let's take a look at some typical cases. The first one is natural ventilation, the most common one. In the US, many homes do not have a forced air ventilation system. So the only way to improve indoor air quality is to open the windows. One simple approach is to open the windows as frequently as possible and use the exhaust fan in the kitchen or bathroom when the windows are open. Otherwise, the ventilation rate may not be sufficient. So the idea is to borrow the power of fan system to enhance the natural ventilation. The important thing to know is to know when to open the windows and when to purify the air. Gabby, I think you can give us some insight into being aware of what's going on outside.
Right, thanks, Chuan. It's actually confusing, right? Especially in these times when we are seeing coverage all over the news about the decrease in pollution in countries around under lockdown. And yes, it's true that emissions from factories and also traffic have dropped dramatically, which does impact the air quality we breathe. And as you can see in this video, you can see the before and after the lockdown in Italy. And you can see a dramatic difference in the air quality between the 2 times in the video. And this makes you think that it's always a safe time to open the window during the lockdown because the air is so clean. But unfortunately, I will be bursting the bubble here because as we touched upon earlier, there are different types of pollution and different sources that you need to be aware of. And so one example for that is in this video. You can see a major dust storm that occurred last week in Israel. As you can see, so dust storms are actually naturally occurring phenomena. It's a natural pollutant. And whether there is a lockdown or not, the air pollution from natural sources will continue to occur. Same for pollen. We see that the lockdown happens in the peak of the pollen season. Pollen continues regardless of the lockdown. There are also other examples that some pollutants surprisingly actually increased. For example, there is a new study that suggests that ozone increased in China when the NOx from traffic decreased, and this is because of photochemical reactions. As you can understand, air quality can change dramatically from 1 hour to the next, from one location to the next, even during the lockdown, and you cannot be sure if the air quality is good or not. And hence, you need a reliable source of data to provide you for that information. So the most basic data source would be the monitoring stations operated by the local governments. However, there are 2 main problems with the stations, the monitoring stations. So one is the location. It could be that the closest monitoring station to your house is actually very far and could be even 100 kilometers away. But even if it's not so far, the air quality changes from one place to another. And if I'm located next to a road, but the monitoring station is across town at a park, the air that it actually measures is not the air that I am exposed to. The other issue with monitoring stations is that they have a delay in time. It takes time till they process the data and deliver it to the public. And hence, it may be that the air quality that they report is 2 hours and even 7 hours old, which is not relevant to what we see now. So what we think in Breezometer is that you need a comprehensive understanding for air quality. And in order to achieve that, you need to combine different layers of data, which include dispersion models, include models for dust, include models for fires, and pollen as well. We need also to take into account traffic or emissions that come from traffic and satellite data. And only combining all these layers together, you can get a true understanding of the real-time air quality and to basically decide when is it a good time or safe to open the window, right?
Thank you, Gabby. Thank you for the valuable background information. Before I dive into the other solutions, some of us may live in a house or apartment with mechanical ventilation. In such cases, there are more options to increase the ventilation, such as turning on the AC unit to 100% outdoor air mode and turning off or turning down the return air. The windows can be open as well, especially when it is a large home or there are many occupants in the home. As Gabby has mentioned, it is important to know what outdoor air quality is, even when we are talking about mechanical ventilation strategies. A more complex case is the mechanical ventilation system that is shared by multiple rooms. What we have learned with the SARS virus is that virus particles can travel through air vents. Researchers have already collected COVID-19 samples from return air ducts in hospital. In some cases that we have seen, such as in cruise ships, but also in some buildings, there may be a risk of virus particles being spread through AC system that share return air.
It's actually interesting that I saw recently on the news how they need to rebuild some sections in the hospitals for the COVID-19 patients just because the air system is the same as the whole hospital and they needed to separate it in order to not pass the virus, as you mentioned.
Very good point, which is why it is important, Gabby, that if you happen to live in a building with such a system, you should contact your building manager and ask them to turn off the recirculated air in the building, or confirm whether there is an advanced air cleaning equipment in place. There are several high-rise apartment buildings in New York, I know, using shared return air system. There are more in some other major cities. If you are not sure about the system type in your home, opening the window as the main way of ventilation is a good way to go. And lastly, we have air cleaning technology, including filtration and purification. Filtration targets pollutants such as particulate matter, like Gabby explained before. Purification addresses gas phase pollutants like volatile organic compounds, VOCs, carbon monoxide, and NOx. To reduce the risk of airborne transmission, air cleaning technology can be used to capture particles in the air that are potentially carrying the virus. And if you decide to go with an air purifier for your family, look for one that is equipped with HEPA filter, as they can remove particles even smaller than 0.3 micrometer in diameter through a physical process called diffusion. As air cleaning technology that offers antimicrobial features is also very helpful. Another important thing to note here is that the concentration of air pollution indoors is never evenly distributed. So when considering where to put a HEPA air purifier, it is a good idea to place it in the room or area that you frequently occupy, so that the air quality where you spend most of your time is as clean as possible. Ronette mentioned earlier, Delos Darvin home in Australia that integrate breathometers data. I just want to briefly introduce the overall product to help everyone to understand it a little better. Darvin is a home wellness intelligence platform designed to passively enhance your health and well-being. To do so, it continuously monitors indoor air quality by sensing the levels of several pollutants, including particulate matter and VOCs. When the levels of those pollutants exceed a safe threshold, Darvin engages HVAC system to remediate the situation through its air cleaning system. And in addition to IAQ monitoring, it also monitors outdoor air quality, which comes from breathometer, and it is integrated into the overall dashboard that display indoor environment conditions. We wanted our homeowners to be equipped with this information as air quality is important everywhere, both indoors and outdoor. As knowing what is the quality of outdoor air can impact decision making, such as whether and when to open windows to let the outdoor air inside. All right, before we go to the conclusions, I have mentioned that there are many reasons why people are not opening windows enough, like sensitivity to pollen, poor outdoor air quality, or simply it is just too cold or too hot or too noisy outside. Here, I prepared some practical solutions to help. If you are sensitive to pollen, especially given that we are right in the pollen season, consider using real-time pollen data to avoid the peak time during the day. If you live in a big city or near to a high traffic, look at your local air quality index or pollutant data. If you feel discomfort when the window is open, perhaps it is too cold or noisy outside, consider using an indoor air quality monitor and look at the carbon dioxide level. When the CO2 level is between 400 to 800 ppm or even lower, your room is very likely well ventilated already, so you do not need you don't have such a need to open the window during those times.
Thank you, Chuan, and thank you, Gabby. So we've come to the end of our live event today, and we do have a few moments to answer a couple of questions. I have one that can go to Chuan quite clearly, and one that's more directed towards Gabby. So Chuan, this one's for you. How does Delos think about healthier home environments more broadly? In addition to the things.
Oh, wow. Okay, good. Thank you for the question. I think it's a good one. It's addressing not only about air quality, it's about something else. So we focus a lot on IAQ, indoor air quality, but actually that concept belongs to a bigger one, IEQ, indoor environment quality. There are several more features at a home we want to take into our consideration, like the water filtration to remediate the geographically important water quality issues from all water source in your home, kitchen, bathroom. We also want to address the aspect of dynamic circadian lighting system that can mimic the natural sun patterns throughout the day to balance your sleep and wake cycle. And finally, it also includes comfort-focused technology in your bedroom, for example, such as dynamic temperature control or automated blackout sheets to create a supportive and comfortable sleeping environment that minimizes the potential disturbance and promotes the restful sleep.
Thank you, Chuan. We have one more that we're going to pass to Gabby, and then we're going to part for today. Gabby, you mentioned before very briefly high-risk population for COVID. Is there a connection between this high-risk population and those who are sensitive to pollution? So sensitive populations when you're talking about pollution.
Right. Thank you for the question. I think it's a great question because we touched on the connection between long-term exposure to air pollution and the COVID-19, but actually the relation is two parts, right? We can divide it to the relation between long-term exposure to air pollution and some diseases, for example, different respiratory diseases like asthma or COPD, or heart diseases. And the second connection is between people that are sensitive, that are older than 65, or have diabetes, or have heart issues, or have these respiratory diseases, and the severity of the COVID-19. So these people are likely to have more severe symptoms, and sometimes, unfortunately, also lead to mortality. And so the answer is that yes, I mean, many of these groups are shared in terms of the same people that are sensitive to air pollution are also the same groups that are sensitive to the COVID-19.
Thanks, Gabby. Now it's time that we're going to say goodbye. I want to say thank you to Chuan and to Delos for being a part of this interesting event that we've really enjoyed. And thank you to Gabby for joining us today. And lastly, I want to say thank you to all of you for being here with us. And we hope to see you on our next live event. Have a good one.
Thank you, Ornit.
Thank you.